Hi, my name is Emily Thompson, and my topic was on controversy in boundary issues. Boundary issues are important because boundaries are a main component in the therapeutic relationships. Setting boundaries can help a client develop trust, and it provides safety against impulses. Having fluidity when it comes to boundaries, having them not be too strict or too loose, can help a client grow. Also, boundaries can allow exploration into the past and the present for a client, and they can also set the stage for future relationships in the client's life. Appropriate boundaries are, again, flexible but firm. They're not too strict, but they're not too lax either. Boundary crossings are when the therapist change roles in the client's life. Now, this can potentially be helpful. Some say that this is dangerous and potentially detrimental to the client, but many people agree that it can potentially be very helpful as well. Boundary violations, on the other hand, are always unethical. It is a breach of boundaries, and they can be potentially very harmful to the client. Multiple relationships, like changing roles, i.e. boundary crossing, is another topic that goes more in depth when it comes to boundaries. Some things to question are if it's in the client's best interest, is it necessary or is it avoidable? And if you need to change roles or have a different relationship with the client, is it worth that risk? And lastly, the client or the counselor needs to ask themselves if they're being objective about it. Current issues are the slippery slope phenomenon when it comes to boundaries. This theory states that it's inevitable that after a certain amount of time, the boundaries begin to erode between a client and a counselor. However, a lot of people say that this needlessly leads to apprehension because not many practitioners are unethical in their behaviors. Many of them stay within the ethical guidelines, and research has suggested that only 2% of licensed psychologists are ever investigated by state boards. However, some people believe that many violations are just not reported, and other studies have shown that 4.58% of females have had a sexual involvement with their psychologist. So when it comes to multiple relationships in therapy, there's many facets that can go through. Psychologists can have another role with a client, they can have another role with somebody close to the client, or they could have another role with a client in the future. In these instances, the counselor needs to be very diligent in defining the boundaries. They must be aware of those boundaries and when they're being crossed. And again, it can be very beneficial, but it is very risky. Lastly, I read an Indian journal, and they have much more rigid boundary lines. They see it as the edge of professional behavior, that multiple relationships are unacceptable, that doctors should dress formally, it should just be professional. The therapist is there to listen, not to speak so much. However, they do see touch as a potential for bonding. However, it needs to be used discriminately. My case example is that of a girl named Anna. She is seeing her therapist, Dr. Scott, for 6 months. She came to him because it was suggested that she is suffering from a sexual addiction. So Dr. Scott was sure to set strict boundaries with her. However, after so long seeing her, he felt comfortable enough to touch her arm as a way to try to comfort her during a particularly rough session. Since then, Anna has had a romantic feeling towards Dr. Scott and has made him aware of that, but has also said that she wants to continue seeing him. So my question to you is, what would you do if you were Dr. Scott? That's it for my presentation. Thank you very much.